Hello there. Everyone say that Canadian medical system is the best in the whole world, and if we try to compare it with the Indian medical system, then it's really great. Well, I don't agree with it 100%. Well, of course, Canadian system medical system is good, but comparing it within every aspect of the medical, I don't think so. It's really good. I'll give you my own example. I got into a car accident. I'm not going to talk about the details of the car accident, but what I'm saying is I started having certain pain in my body, especially in my arms. So I started getting a physiotherapy. My left arm is fine, but my right arm, instead of getting better, I started to have more and more pain in my right arm. So now it is to that extent the pain that I can't do the things. I can't hold the thing in my hand. I can't even hold a cup of tea in my hand. I started shaking my hand, the right one. And in the night time, I can't sleep. Especially if try to sleep on the opposite side of this hand, and the hand is my whole arm is in the air. I start paining. What I'm saying is I'm in a pain day night. So anyhow, when I gone to the my family doctor, they said that they suggested me a physiotherapy only. But again, end up with them, and I told them I'm really in pain. I really need help. So what they did is they sent me for a X-ray, and I was really surprised why they're sending me for the X-ray. Uh, when in fact it doesn't relate to bones. This is what I was trying to understand. Anyhow, X-ray came clean. There was nothing X-ray came. So the doctor said, well, there's nothing wrong with it, and you're fine. Eventually, it will heal up. So that was the answer from my family doctor. And then again, I was in pain and nobody knows that, and came home, and then I end up in the emergency hospital because I don't have any other option left now other than go to the emergency hospital. And I thought, okay, fine, I'll go to the emergency hospital. They will try to help me there because the thing, like all the ultrasound and all the machines are there, and they will test me, and they will come to know if there is something wrong with me, because I knew there is something wrong with me if I'm in that much of pain. So after waiting for 6 or 7 hours, I got my turn in the emergency hospital, and then they checked me. The doctor was very nice. He listened to me very nicely. He listened to all my angles, where it hurts, and all that kind of stuff. And then later on, he suggested me for a neurologist. That it looks like more of a nerve pain, and I will refer you to them. So I requested him, can we have an ultrasound done on this one? At least we know what is the issue. And he told me that he's sorry, he doesn't have the authority to order that. And I was shocked because emergency doctors do have an authority. But he said the reason is because nowadays they told us there are more important, or the more urgent cases are there, the patients who really need the ultrasound rather than me. So even though I'm in a pain, but I'm not a urgent case, I'm not an important patient. For them, importance was somebody who have a cancer or something like that. So he refused completely. So I have to come home, and then I'm waiting for that neurologist from like few months now, and then I end up contacting them that did you get my referral? And they said we did get it, but doctor will call you. So now doctor will call me to say that okay, we got your referral, and then after that they are going to give me an appointment that this and this, I don't know, it will be 6 months, 7 months, 1 year, I have no idea, and I have to stay in pain till that time. So anyhow, after that again I end up with my family doctor that, well, I'm in pain and I really need help and I don't know. So, and I started crying there too, and I he really said, okay, I want to help you, but what can I do? Like, is it can be, I mean, he was suggesting that it can be nerve pain, and maybe some nerve is pinched or something like that. So I requested him, can I have an ultrasound, and at least I can pinpoint if there is an issue. Uh, then I can just fix that one. But he refused again. And I insisted so much that he said, no, no, we can't have an ultrasound done. What I can do is I can give you a prescription for a nerve medication. So he suggested me a medication, and he told me to take that medication, and then after that for 1 month you can take that, and then we will see if it helps you or not, and then if it doesn't, then maybe we'll send you to the pathology test, which is basically a joint, like when there's a disease which affects the joints. When he said that, I was really really shocked. Oh, okay, now I'm getting a disease on my joints, that is more painful than anything else. Anyhow, so and again I keep on requesting, please. I said if I knew, then it will help me. So I don't know what came into his mind, and he said, okay, I will refer you for the ultrasound. So he referred me for the ultrasound as well. So this was at the end of February, like the 28th or maybe 1st March, I don't remember exactly, when I gone to him. And then I started taking the medication, and next day, when I got up, I felt dizzy. It looks like I didn't had enough sleep like the way it was, but I thought maybe I didn't because I was not sleeping properly in the night, anyways. So it was happening every day. I whole day like I'm dizzy. I feel like to vomit. My condition was like that. I was not like I'm not positive at all in my work, but at least I was doing some kind of a work. But with this medication, I was on the complete bed because I can't do any single thing. I was on the bed, laying down, not feeling good. And then I started realizing why this happening with me. Initially, I thought maybe something wrong with me. Then I started connecting with the medication. Now, this medication was not helping me at all in my pain. My pain was there, same level. But on the other hand, it make me more worse now that I'm in like pain, but I feel dizzy most of the time. So after 15 days, I stopped the medication and I'm better now. And then I just had a ultrasound done. So anyhow, when I booked the ultrasound on the same day, because it was with the appointment, I got 1 month. Like after 1 month, I got an appointment. So 30th of March, I gone for my ultrasound, and my ultrasound result came, and the doctor told me that you have a tear in your muscle. So it was my muscle is teared, and they're giving me medication on my nerve. They are not sending me for ultrasound. So let's say if I wouldn't have insisted so much, they wouldn't have done the ultrasound, and then I would have been in pain for wrong reasons, and they would be giving me medication for which I'm not even like what should I say? Um, I'm not even like I mean to say that they should not be giving medication for the reason for which I'm not even like sick. Anyhow, the doctor told me that okay, I'm going to refer to you to the what you call this orthopedy, which is basically that's a surgeon for the muscles and all that. So basically, they're going to do a surgery on this one on this muscle. I don't know how big the tear is. So what I'm trying to say here is, and I don't know. Now they have to call me, and after that they're going to give me an appointment, and I don't know how long that appointment is going to be. 1 month, 2 months, 6 months. When I'm going to get my date for the surgery. Till that time, I'm in pain. So this is what the Canadian medical system is, which I was trying to say that. If I'm in India, this wouldn't have happened with me. I could have gone, done the ultrasound, and if I'm in a pain, I would have gone for surgery right away and done with it. Yeah, of course, you do need a money. Well, I'm not saying that, but in Canada, even if you have a money, you can't do any single thing about it. You have to wait for the appointment. You have to wait for all those things. So. In Canada, if you're not dying, you're not in that situation, you will not get a help. If you are in a pain, severe pain, whatever it is, it doesn't matter. You have to wait. And then system is such a like I find the system is so stupid. If they would have done my ultrasound on the very first time, they would have find the reason for it, right? They send me for x-ray. I don't know why. And now it's a cost. So you can say that I have visited the doctor so many times, that cost. And then of course not on me, for the government, but x-ray cost and ultrasound cost. I end up in the emergency, that cost, and some time or some other day, neurosurgeon will call me, neurologist sorry will call me. So I think they're making more burden on themselves instead of thinking, okay, she's in a pain, she doesn't have it. If it is a bone related injury, I would have been a very different kind of a pain. I don't know why they send me for the x-ray for that. Anyhow, so this is what the Canadian medical system is, and that's how I mean, I don't like for very small things they will just let you cry and whatever you can do, and you have to stay your life like that. So this is a difference between Indian and the Canadian. In India, of course, if you're dying and you go, you run for the things and all that. That's totally different situation. But for normal day-to-day living, the Canadian system, I don't find it to be pretty good. So I'm in pain from so many months, and I have to insist on my own. I have to force the doctor for that, and they gave me the wrong medication. For no reason. So yeah, so this is my views about the medical system, and let me know what you guys think about it.